We want to think about disasters as if they're marked off in time and space. And so people want to say there was this beginning to Katrina, but then the big question is, what are the long-term consequences for the children of the storm who survived this catastrophic event? And so soon after the storm, along with a fellow sociologist, Alice Fothergill, who is at the University of Vermont, we actually launched a study to examine children's long-term recovery after Katrina. We ended up interviewing and observing well over 700 children and their family members. In the end, we ended up following what we call our 25 core children intensively for the entire 7-year period of the study. Our data showed that children who were living in the most marginalized situations before Katrina, they were the ones who were most likely to end up on a declining trajectory in all the spheres of their lives. There were also some children, they were really vulnerable before the storm, but then they were able to find equilibrium after the storm. One of the girls that we followed over time, we call her Sierra, and she was 11 years old at the time of Katrina. By almost any indicator before the disaster, Sierra would have been considered vulnerable. Katrina made landfall, and Sierra, along with her mom, they were trapped in this hospital. They ended up being rescued by boat. They were taken to the Superdome. And then they joined a wave of thousands of Katrina evacuees. All at once, unexpectedly, Sierra and her mother lost their house. They lost their neighborhood. They lost access to their family members that they loved and their sources of social support. They lost that all. But then fast forward nearly a decade after Katrina. Sierra has a college degree in psychology. She ended up going on and working on a master's degree. She works in the mental health field now. Our data showed that having an advocate in the life of a child absolutely made a difference in terms of shaping that child's recovery process. After a disaster happens, advocates, they're the ones who are able to move into action, and they're able to mobilize resources to try to help children speed their recovery. Advocates included shelter volunteers, church pastors, teachers, school administrators. After the storm, advocates helped Sierra and her mom to secure a FEMA trailer so that they would have housing. They helped Sierra's mother to get a job. For a period of time, they were picking Sierra up in the morning and taking her to school because the school bus didn't go out to where the FEMA trailer was located. That wasn't sustainable. And so over time, they ended up getting a car for Sierra's mother. And so they were doing all of these things, but they actually had a broader vision. We know Sierra is just one child, but her story reveals something much deeper. Not all children had access to those advocates. It was almost by chance whether a child was lucky enough to land in a community where there happened to be a person who happened to know something about children's health and well-being and needs, and then if that person happened to get connected to that Katrina family. And we don't think that's good enough, because hope isn't a plan, that we just hope a child is going to end up with access to advocates. Is there a way that we could systematically embed advocates into the organizations that are doing disaster planning and response and recovery work, so that we can ensure that children's needs are not overlooked? All children should have access to advocates who are working on their specific needs.